Good evening, everyone. I'm very excited to be able to talk to you tonight about how I want to break the wall of non-alcoholic fatty liver disease, or in short, NAFLD. NAFLD is a disease that is affecting more than 25% of the population globally, and its number is supposed to increase. In more simple terms, I could also say that every fourth person among us tonight might potentially have an early stage NAFLD and potentially doesn't even know about it. NAFLD can lead to end-stage liver disease such as liver cancer or liver cirrhosis, but most of the patients die of a heart attack or a stroke. And I don't know about you, but I'm the kind of person who remembers and understands certain things and diseases better once I actually see them in person. So let me introduce a patient to you. This here is Herbert. Herbert is, as you can see, overweight. He has high blood pressure, he has diabetes, and as you can guess, he's probably not the most physically active person you've ever seen in your life. When he comes to me, the hepatologist, and asks me to check if he has NAFLD or not, I can for sure do that. But once he asks me what pill I'm going to prescribe to him in order to stop NAFLD, all I can say is M. And the reason why I'm saying M is because it stands for Eat Healthier and Move More. And that is why, because as of right now, there is no approved medical treatment for NAFLD. So what is it that I'm doing in my research? For that, I need to give you a little bit more background. First of all, there's a disease called Wilson disease. It is a protein misfunction where copper gets trapped in cells and leads to accumulation in tissues. Those patients have low copper in their serum, and interestingly, 50% of these patients actually show fatty liver. And now where it gets really interesting, at least for me, is that NAFLD patients also show a copper misbalance and a low copper in the serum. The big question, however, though, is how? Nobody knows. So this is the first part of my research project, trying to figure that out. If you go through the literature, you find some ideas. One is saying you have the healthy liver, and you eat the Western diet, which is high in fats and high in sugars, which causes NAFLD and an unbalance of copper. The other theory is that the changed metabolism of fat and sugars causes the unbalance of copper, which leads to stress and then to NAFLD. My research so far has shown two very interesting things. I've been using a Wilson disease mouse model, and I've been treating these mice with a high-fat diet. I can show that these Wilson disease mice accumulate significantly less fat in the presence of a high-fat diet compared to a normal mouse, healthy mouse that receives the high-fat diet. Furthermore, I'm able to show that if I'm only looking at the Wilson disease mice, that the ones on a normal diet, they keep accumulating copper and copper over the lifespan, whereas those Wilson disease mice that have been fed with a high-fat diet actually stop at a certain level, and then copper levels start decreasing, suggesting that copper is potentially being used for something. NAFLD is a very complex disease, so it will not be possible to treat it with just a simple pill. But imagine with something as simple as a copper pill, supplementary pill, it is actually possible to treat the disease. Until then, however, all we can do is to continue to promote the lifestyle of M, just like I did with Herbert. With that, I thank you for your attention, and I'm open for your questions.
Thank you so much, Aline. That was bang on time. Thank you. So, the jury, who raises the arm first? Georgia, please come up with a question.
I'm curious that if people still take this pill, but then they still continue their lifestyles that were unhealthy beforehand, will that negate the effects of the pill?
That is a very good question. Since we haven't been able to test it in humans yet, I cannot give you an answer for sure. The most effective therapy is, as of right now, to actually change your lifestyle. The hope would be, though, however, that we at least are able to prolong it and, slow it down the progression.
Second question. Naja?
Sure. The longevity of this pill, once you start taking it, do you have to continue it in perpetuity, or can you stop once your NAFLD has been cured?
This will also be something that human studies will actually reveal. As of right now, if you look society, I feel like societies are not afraid of taking multivitamins. So this is just like another nutritional supplement. It could definitely be discussed, however, if the NAFLD has declined, to actually stop it again.
Hands up.
Thank you, Sophie, and thank you, Aline.